My name is Jamie Berard, and I focused on describing what autism is and what are the signs and symptoms to look out for. So, autism spectrum disorder is a neurodevelopmental condition that affects social skills, communication, and behavior. Autism is not defined as a single condition, but it's actually on a spectrum, meaning that each individual has unique strengths and challenges that they face when affected with this diagnosis. It's estimated that 1 in 36 children and 1 in 45 adults in the US today are affected. The condition varies significantly from person to person, such as some individuals who are affected are verbal, while others are nonverbal or minimally verbal. Additionally, some may have intellectual disabilities, while others do not. So the level of support really is dependent on, what range of symptoms occur, and the kind of support that they need is very variant as well, from a minimal standpoint to a very substantial amount of assistance. So some signs and symptoms that individuals with autism who are affected have difficulty with are things like social reciprocity. One of the big things in autism is they suffer from social communication challenges. So they struggle with back and forth conversations, sharing interests, and then also just responding appropriately in social situations. You'll notice that individuals with autism also have reduced eye contact and facial expressions. This is just because they don't necessarily understand verbal cues, so they don't use them, and then they don't necessarily understand other people who use them. So they have trouble with interpreting like tone of voice, facial expressions, body language, and then they usually use delayed or atypical speech. It's one thing that we call echolalia, which is repeating words or using like an unusual speech pattern. And then also, as mentioned before, they have trouble with like social cues. This goes along with relationships, so they find it very difficult to form and just maintain relationships, even if they have them, just because they don't think, like other individuals who don't have autism. One of the other key indicators is that they use restricted repetitive behaviors. One of the main things about autism is it's known for individuals who stim, which just means that they use like repetitive motor movements, such as like hand flapping, repeating words, phrases, spinning. They also insist on routines. So any like deviation from routines is very stressful, even in just like a small change, like going to get their hair cut or brushing their teeth or things like that. And then they can become very highly focused on things. As children, they're very, attentive to numbers or trains. And then like as adults and even as children, they are very hyper focused on like TV shows. And then like you'll notice like if you turn off those shows that they'll become very distressed. They're very sensitive to sounds and lights, textures, temperature. So they have sensory sensitivity or even under sensitivity. It can vary. And then just like I said before, like they don't think the way we do, where we would play with a race car, roll around a racetrack or have an airplane and fly it in the air. They would line the toys up or play with just one specific part of a wheel on a car. So, or they might do the same thing over, going back to those repetitive movements. So these are just a few things that really, are key things to look up.
Hello, my name is Angeline Lucas, and I will be discussing ASD versus IDD. Intellectual disability is formally known as Intellectual Developmental Disorder, or IDD for short, by the DSM-5-TR. IDD is defined as a neurodevelopmental condition that affects both intellectual functioning and adaptive skills. Individuals with IDD struggle with reasoning, problem solving, and learning, often measured by an IQ below 70. Additionally, individuals with IDD may face challenges with everyday tasks such as self-care, social interactions, and independent living, making support from family or caregivers essential. Autism spectrum disorder, or ASD for short, is also classified as a neurodevelopmental disorder by the DSM-5-TR. While ASD and IDD can co-occur, they are distinct conditions with different underlying causes, symptoms, and treatment approaches. People with IDD may experience delays in social communications, but these challenges may stem from cognitive impairments rather than autism-specific traits. Additionally, ASD should not be diagnosed if an individual's symptoms can be clearly explained by IDD or general developmental delays. For example, someone with IDD may have an average IQ, but still require continued assistance from caregivers beyond the typical age of dependence. To diagnose both ASD and IDD together, a person's social communication abilities must be below what is expected for their general developmental level. Because of the similarities and differences between these two conditions, accurate diagnosis is crucial for ensuring individuals receive the right support and interventions tailored to their specific needs. Thank you.
Hi, my name is Caitlin Musillo, and I'm going to be talking about the diagnosis process for people with ASD. So an experienced professional does have to assess the developmental history, the behavioral, and the use of diagnostic tools. Um, and they also, it is important to remember that positive screening results aren't a diagnosis and that they should be following up with other assessments and that are required. It just can't be one assessment. There is also no lab test for autism, but um, like you are able to do genetic testing to identify differences in the brain to help guide the support. And it is also important to remember that the developmental pediatricians trained in autism often administer assessments like the Autism Diagnostic Observation Schedule, also known as the ADOS. So some of the screening tools that are used to help during this are the M-Chart R-R, which is used on 16-month to 30-month-year-olds, and it is a parent-completed questionnaire. And another one is the SQ, which is used for school-age children, and it is a 15 questionnaire for parents, educators, and professionals. Another one is the SACS-R and the SACS-PR, which is used for 12 to 16-month-year-olds and is a tool is tools to identify autism behaviors and is administered by professionals. The last screening tool is the AQ test, which is used for children who are 16 years and older, and it is a 50 question self-assessment for adolescents and adults with an IQ over 80. It is also important to remember that these aren't the only 4 tests. These are just the most common ones that are used for the screening process. So with that, that leads us into our first question. Are the screening tools and level of disability only assessed once, or is once or is this something that will be reassessed throughout their lifespan/treatment? And the answer is there are 2 screenings within the first 2 years of a child's life. And if they are questionable, they will be evaluated for additional screenings. So every child does get a screening within the first 2 years of their life. And um, if they are diagnosed, then they do get reevaluated every 2 to 3 years after diagnosis and at every developmental milestone. So typically more often when they are as a child. But after that, like when they grow into their adolescence, they'll get screened every 2 or 3 years. So going back to the diagnosis process, it is important to remember that social difficulties must have challenges in all 3 areas. The social, emotional, reciprocatory, it's such as the back and forth interactions that's also assessed, and the nonverbal communication, such as body language, eye contact, and just other things like that. And they also look at the relationships with other people, such as if they're having difficulty initiating or maintaining relationships with those in their life, besides probably like their family. So moving forward, the 2 things that they do look for for diagnosis is they have to have 2 of the following behaviors, such as repetitive behaviors. For example, that would be hand movements, phrases, and another one would be instances on sameness, such as routines or orders. So they just have to have like the same thing happening. They can't stray from your routine. And the next one would be an intense or unusual interest, such as obsessions with specific topics or toys, or just general, like obsessed with something very specific. And lastly, sensory reactions, such as over or under sensitivity to a sensory input. So to get diagnosed, they have to have at least two of the following. That's usually the typical rule of thumb that people who diagnose follow.
Okay. Hi, my name's Rudy, and I'm just going to be talking real quick about the quality of life, as well as some treatment and interventions for autism spectrum disorder and intellectual disabilities. So to start, I'm going to talk about quality of life and some accommodations that can be helpful towards ASD and IDD individuals. So these individuals face many daily challenges, such as social difficulties, sensory and motor issues, mental health struggles, bullying, and socioeconomical barriers, and many other challenges can occur. And so, to counteract these difficulties, they can undergo support services such as academic supports, sensory supports, social supports, job modifications, environmental modifications, communication supports, assistive technology, and then there are many other support services available for them. And so through these accommodations, we can help them achieve an improved quality of life. All right, next we have treatment and intervention. And so currently, our goal with treatment is to help them reduce their symptoms that are interfering with their functioning throughout their day. And as we said before, to improve their quality of life. And so, specifically, some examples of treatment include behavioral therapy, which uses reinforcement strategies to encourage positive behaviors and reduce unwanted ones. Developmental therapy, which will help improve their skills of speech, language, and motor skills. We have educational approaches, which is structured learning, which uses visual aids and predictable routines. They can undergo social skill training to help build relationships and improve their communication through peer-to-peer interactions. There are several medications out there that might help these individuals manage their irritability and hyperactivity. However, these medications do not directly cure their condition. There is also psychological therapy, which includes coping strategies to help with their anxiety, stress, and emotional regulation. And last but not least, there are many alternative forms of treatment out there that may be beneficial, such as dietary changes and acupuncture. Thank you.